So VAST is the local infrastructure organisation for the voluntary sector across Stoke-on-Trent. So we support voluntary sector organisations so that they can provide support to their beneficiaries. And we do that through lots of different ways, providing direct support around governance, finance, funding, but also practical support and supporting them to get their voice heard with statutory organisations.
Support Staffordshire is the local infrastructure organisation for voluntary organisations in Staffordshire, and we support our member organisations in all the same ways that VAST do, and we work very closely with VAST. So Support Staffordshire and VAST, working together over the last 2 years, have set up the VCSE Alliance for Staffordshire and Stoke-on-Trent. And the whole idea of those forums is to bring together the parts of the voluntary sector that's really interested and engaged in health and care in its broadest sense, to give them a voice, to let them input into plans, strategies, policies, clinical pathways, but also it's a kind of think and do tank. So those forums are places where organisations can come together to collaborate.
Volunteering is there to provide added value and to supplement the work that's doing. It's about people being there to listen and to care for people when the paid staff haven't necessarily got the time to do that.
So sometimes perhaps assume that voluntary might mean amateur, which isn't the case at all. The quality can be just as good in the voluntary sector as in the NHS.
I was introduced through Support Staffordshire, and I've been volunteering in one way or another towards health benefits in lots of ways over the last 12-15 years. There are multiple areas of benefit to patients and also to carers and to the public alike. I think I would see 24-hour crisis online and phone accessibility to patients and to carers as something that the NHS isn't currently able to provide, and organisations like Samaritans, Silverline, Childline are obviously there and extremely able and willing to provide that sort of first port of call. I think really the idea would be, and the ideal, is the reciprocity of all three sectors working together with a view to people being able to leave behind a label which they may feel they've become, and to rediscover themselves as a valid and interesting contributor to the social society that we have today. I've been able to feel as though I'm not quite in the sidings and rusting at my older adult qualification time. So I'm grateful and thank you to volunteering.
So as an alliance, we've come up with 4 priorities to work with the voluntary sector and the ICS.
First is commissioning and funding, how the NHS and partners work with the sector to ensure more resources can flow into the voluntary sector where that's appropriate.
And the second priority is volunteering. That's about ensuring that people can take part in volunteering and there are good quality volunteering opportunities within health and care settings.
Number 3 is communications and engagement. So that's about working with the whole of the voluntary sector to have really good communications about opportunities, about policies, about changes that are happening in health and care, and also working with those organisations to reach the people that they work with, sometimes perhaps referred to as seldom heard.
The final priority is social prescribing and prevention. And by that, we will be working across all of the portfolios in the integrated care system to make sure that everything the voluntary sector is doing is embedded within all the health and care environment.